To all the young parents, please never do this to your kid who is below 5 years old, or they may get their elbows dislocated. Hello friends, how are you doing today? Welcome to our channel Let's Speak, and I am Gunajit Sharma. So today we will be discussing about dislocated elbow in kids, which is also called as nurse's elbow. This is a very common condition in young kids who are below 5 years old. We as parents, we always play with our kids or we lift them all the time. But many a times when we play with them or we lift them, we always lift them the wrong way. That is, we hold them in their hands or we hold them in the wrist and we'll lift them up. So kids below 5 years old, their ligaments are very soft and it is very easy for the ligament in their elbows to slip out of their joint and get stuck. So this is called nurse's elbow or a dislocated elbow. So now the question is, when can nursemaid elbow happen? So the nursemaid elbow can happen in the following conditions. So suppose you are pulling them with their hands or the wrists, or suppose you are playing with them and while playing you are lifting them up by holding both their hands and wrist and you are swinging them. Or it can also happen when you suddenly grab them by their hands or the wrist and you pull them. For example, suppose you are crossing a road and while crossing the road you hold his hand, suddenly you grab him and you pull him. So these jerk motions can also cause the nursemaid elbow. And last but not the least, even sometimes when you try to protect your child from a fall, even that can cause a nursemaid elbow. For example, your child is about to fall and the only thing you manage to grasp is his hand and you hold him with his hand. So even in this condition, nursemaid elbow can happen. That is, the child may get his elbow dislocated. Nursemaid elbow can happen up to 5 years of age, mainly because up to 5 years the ligaments are not very strong, and after 5 years the ligaments usually get stronger or tight. Now, how do you know if your child has the nursemaid elbow? So usually it is very difficult to understand if the child has got nursemaid elbow because it doesn't cause any deformity or even swelling in normal cases. So parents, they need to look out for the following symptoms when they suspect that their child has got nursemaid elbow, or if they think that they have played or lifted their child in the wrong way. So the child may cry or he may not cry when his elbow is dislocated based on his pain tolerance. But the child will definitely not want to use the hand in which the elbow is dislocated because moving the elbow is painful for him. He will always keep the arm in a straight but slightly bent position such as this, so that because of the pain, because moving his elbow will cause him pain. And then he will try not to pick up his toys or any such things with the hand which is having this elbow dislocated. So what is the treatment for nursemaid elbow? So in case you suspect your child has nursemaid elbow, you should immediately take him to the pediatrician or the doctor. So usually all the doctors are aware of this nursemaid elbow because it is common among the kids who are from the age 0 to 5. So what the doctor will do is, there are some set of procedures like flexing your arms and twisting your arms by flexing your elbows. So some sort of exercise which the doctor will perform and the joint will get fixed again. But please note, don't check on any videos and try to do it yourself because this may cause further harm to the children. Always go to the doctor and only then you get this problem sorted out. To summarize it all now, nursemaid elbow or elbow dislocation is very common among children below the age of 5. And you don't have to worry in case your child has got this problem. But the only thing is, you should take him to the doctor who will get the elbow fixed, who will get the elbow in the right place. And also please make sure from next time whenever you're playing with your child or you're lifting him up, please don't lift or play with him in the wrong way. Don't make him swing by holding his hands, or lift him up by just holding his hands or the wrists. So thank you for watching our video, and we hope you liked our video and we helped you with some information that will be useful for you. Please do like and subscribe our channel for more health and awareness related videos. So goodbye for now. Thank you.